When should COPD patients consider CPAP therapy? Have you ever wondered when someone with chronic obstructive pulmonary disease should think about using continuous positive airway pressure therapy? This is a vital question, especially for those who may also be dealing with sleep apnea. Let's break down the details to help you understand when this therapy might be right for you or a loved one. First off, if a person with chronic obstructive pulmonary disease also has sleep apnea, particularly obstructive sleep apnea, that is a key indicator for considering continuous positive airway pressure therapy. Obstructive sleep apnea is common in adults over 40 and can make breathing even harder during sleep. If someone is snoring loudly, feeling excessively sleepy during the day, or has had someone notice pauses in their breathing at night, these are signs that they should talk to their doctor about a sleep study. Another important factor is hypercapnia, which means there are high levels of carbon dioxide in the blood. This condition can be dangerous if not treated. Continuous positive airway pressure therapy can help improve ventilation and lower carbon dioxide levels, making it a worthwhile option for those experiencing this issue. For patients who are on long-term oxygen therapy, using continuous positive airway pressure therapy can also be beneficial. Studies show that it may lower the risk of mortality and improve survival rates. If someone has weak breathing muscles or abnormal respiratory mechanics, continuous positive airway pressure can help improve their breathing patterns and make it easier to breathe at night. Now, let's talk about how continuous positive airway pressure therapy works. It keeps the airway open during sleep by providing a steady flow of air pressure. This helps improve oxygen levels and reduces the effort needed to breathe. It can also help with dynamic pulmonary hyperinflation, which is when air gets trapped in the lungs. If you or someone you know is considering continuous positive airway pressure therapy, there are some practical steps to take. First, a sleep study is essential to diagnose sleep apnea and assess how severe the airway obstruction is. Consulting with healthcare providers is also necessary to evaluate respiratory function and check for hypercapnia. Using continuous positive airway pressure consistently for several hours each night is vital. Studies show that sticking to this routine leads to better outcomes, including improved survival rates. Proper mask fitting and device adjustments are also important to ensure comfort and effectiveness. Monitoring for any side effects or challenges with the device can help maintain adherence to the therapy. In summary, chronic obstructive pulmonary disease patients should consider continuous positive airway pressure therapy when they have overlapping sleep apnea, hypercapnia, or respiratory muscle weakness. This therapy not only improves sleep quality but also supports better breathing mechanics and may reduce the risk of mortality. Proper diagnosis and personalized treatment settings are essential for getting the most out of continuous positive airway pressure therapy.